Picture this. Your parent comes out of a routine procedure and seems more sleepy than expected. You spot an extra pill in a cup at the bedside. An hour later, their oxygen drops, and staff tell you a blood thinner was given twice. Your heart sinks. But what you do in the next minutes can change the outcome. I'm Jess. I work at the bedside as a family nurse practitioner, and I consult on medical legal questions. I want to give you simple, usable steps you can actually use right away when something feels off. By the time we finish, you'll be able to recognize the difference between an error and an expected complication, run a short safety checklist in the moment, capture documentation that matters, and use calm scripts that get answers, not arguments. First, what counts as a medical error? In simple terms, an error is an action or omission that deviates from accepted practice and may cause harm. A complication is an undesirable result that can happen even when care meets standards. Context and documentation make the difference. A few short examples to help you tell them apart. If someone with a known severe penicillin allergy is given IV ampicillin, that's an avoidable error if the allergy was clearly documented. If a patient develops a fever after surgery despite sterile technique, that may be a complication. If the airway was mishandled during anesthesia and oxygen drops, that's likely an error. The facts around documentation and missed safeguards are what matter next. If you suspect something went wrong, safety comes first. Ask 2 quick things. Is anyone in immediate danger? And can the action be stopped? If yes to either, act now. I'm going to give you an in-the-moment checklist. You can say out loud or follow in your head. I'll read each step slowly so you can repeat it if you need to. Step 1. Call for help. Say plainly, "Nurse, I need help now. My loved one is drowsy and breathing oddly." Do not apologize for sounding alarmed. Step 2. Stop ongoing harm. If a medication is still being given, ask staff to hold further doses. Please hold any more doses until we check vitals and meds. Short and precise. Step 3. Get vitals recorded now. Ask for respiratory rate, oxygen saturation, heart rate, and blood pressure, and say, "Please document those numbers in the chart." Numbers are objective, and they anchor what happened. Step 4. Ask for escalation if needed. Request the nurse manager, rapid response, or patient safety officer, depending on how serious the change is. If breathing is dropping, ask for the rapid response immediately. If it's a medication concern without immediate instability, ask to speak with management, calmly. Step 5. Start documenting. I'll give you a compact template you can use on your phone or a scrap of paper. Write time, observation, who was present, and exact words. For example, 2:10 p.m. Found extra pink pill in cup at bedside. Patient drowsy. Nurse Maria stated, "I gave medication at 1:50 p.m. Put direct quotes in quotation marks. That matters later. A few quick micro tips on documentation. Record exact times, not around noon, and use plain, observable language. Patient is drowsy, oxygen 88% on room air, rather than interpretations like patient almost died. Those objective notes are more useful in reviews and investigations. Physical evidence helps. If it's allowed and safe, photograph the medication cup, labels, IV setup, or visible injuries. If hospital policy is unclear, ask, "May I take a quick photo of this medication cup for my notes?" If they say no, write down everything immediately. Packaging, label color, tablet description, badge name you saw. Now, let's talk about the language that works when you speak to clinicians. Start with curiosity, not accusation. Say, "I'm concerned about my mom's drowsiness. Can you help me understand what medications she received in the last hour?" That invites explanation and focuses the team on facts. You might be thinking, what if they get defensive? And that's valid. If someone gets defensive, move to a neutral escalation. I appreciate you helping. Because breathing has changed, I'd like to speak to the nurse manager or patient safety officer so we can ensure this is documented and reviewed. Keep your voice steady. Facts calm a charged situation.
If you need to see medication labels, try, "Can I see the medication label or barcode? I want to confirm what was given." That request is simple and focused on safety, not blame. It often opens the chart or med tray without conflict.
Sometimes you won't get immediate answers. If the manager doesn't respond in 20 to 30 minutes and the issue is unresolved, ask for written documentation in the chart. Please document our concern and who responded with times. A written note preserves the sequence of events and shows you followed reasonable steps. Let's step back for a moment and talk about escalation pathways, what each one can actually do for you, and where their limits are.
At the bedside, the immediate care team can stop medications, monitor vitals, and treat acute harm. The nurse manager or patient safety officer can open internal reviews and recommend system fixes. Hospital complaint processes create a formal record and can trigger investigations. State reporting agencies look for patterns and can act on concerns about licensing or facility safety. And an attorney can advise you on legal rights and compensation when harm is serious. Each step has different goals and timelines.
A short, important disclaimer. This is practical nursing guidance, not legal advice. If you believe serious harm occurred, consult an attorney for legal questions. If emotions feel overwhelming, pause and call a trusted friend or a crisis line before taking more steps. Safety is both physical and emotional. Here are a few documentation templates you can use. Say these to yourself or copy them in your notes. Template 1. Time, observation, who, exact words. Example, 2:10 p.m., extra pink pill in medicine cup, patient drowsy. Nurse Maria said, "I gave this at 1:50 p.m. Template 2. Evidence log. Example, photo taken of cup and label at 2:12 p.m. Packaging retained. If you're the person who will later talk to attorneys or patient advocates, keep a running timeline of events for the first 48 hours. Include treatments given, changes in condition, names of staff, and copies or photos of discharge instructions. That timeline is incredibly valuable down the road.
A quick word on relationships. Being calm and factual preserves care relationships and usually gets you better cooperation. That doesn't mean you're minimizing harm. It's simply a strategy to protect safety and get the information you need. If the situation involves a serious or life-changing injury, you should consider contacting a patient advocate and legal counsel sooner rather than later. An attorney won't change clinical care, but they can help you preserve evidence and understand rights around records, reporting, and potential compensation.
Before we close, I want to give you 3 short, repeatable takeaways you can replay when you need them. Say each one to yourself or out loud, and memorize them if you can.
Takeaway 1. Safety first. Call for help, hold further doses, and get vitals recorded now.
Takeaway 2. Document facts, time, observation, who, and exact words. Photos and packaging help. Keep a simple timeline. Takeaway 3. Speak calmly and escalate if needed. Ask for the nurse manager or patient safety officer, and if you remain concerned, seek a patient advocate or attorney. Keep emotions honest, but your language clear. A few closing tips. Bring a trusted advocate when possible. Copy discharge instructions and medication lists before leaving. If staff ask you to sign forms, read them and ask questions. Don't sign under pressure. And if you're overwhelmed, it's okay to pause and return to these steps when you're calmer. If you want the checklist and the exact scripts I used in this episode, they're available at facbynursejessicaconsulting.com/resources. That's 1-page checklists and 3 script templates you can print or screenshot. Again, this is nursing guidance, not legal counsel.
For legal questions, consult an attorney.
Thank you for listening. If this episode helped you feel more prepared for a scary medical moment, please share it with someone who might need it. Subscribe to FAQ by Nurse Jessi so you don't miss future practical guides. Until next time, stay informed, stay compassionate, and always put safety first.